Hello everyone. I am going to talk today about 5G network slicing isolation using VPN Plus, and this is going to be related specifically about our research that we have performed at the Secure 5G for IoT lab at Oslo Metropolitan University regarding cybersecurity of healthcare verticals. In general, this approach can be used in different scenarios, so I will get to the results we have achieved, and also I will introduce many of the concepts in advance, so it will be much more clear what is done in this context. I would like to introduce also our partners. We have Wolffia, Telenor, part of the Secure 5G for IoT lab at the Oslo Met University, and this research is particularly results to a joint effort. To begin with, I would like you to comprehend first the place where 5G is attending at in terms of usability in the healthcare sector as well, despite everything else, as we know, of course. There is a lot of misconception when it comes to 5G, but these are becoming more and more clear as people progress through the society nowadays, and 5G is getting more and more traction. So that's also something to remember as well. Still, the adoption it might be early in some societies, but we witness a lot of new implementations regarding smart infrastructure, and in the healthcare, we expect that 5G will deliver the promised smart healthcare services. So this is done by different ways. One example is by using, let's say, Internet of Things appliances in the model of wearables, devices that are measuring the condition, vital signs of patients, and providing this information to the healthcare providers. So that's just one small example. However, the 5G is very important because not only that, it should provide seamless connection to these various services, but also increased security and, of course, cheaper services as well for the end users, and reliability, ease of use, and many other advantages, of course. However, this come also with a couple of disadvantages, which we're going to cover in this presentation as well. The healthcare, let's call it slice. I will come back to network slicing and explain what the network slice is. It has to be sufficiently secure in order to retain that doctor-patient confidentiality. Otherwise, attacks on the healthcare are known, and they have happened in the past. So it's something that should be thought about and also considered, of course, when it comes to implementing new services outside the box. So we can continue with talking a little bit about 5G exactly in the healthcare. So these services that the patients expect to receive, as well as the healthcare provider to give the same to the patients, are something that should be very transparent, and also something that the healthcare provider as well as the patients shouldn't be concerned about what's happening in the background, the mechanism behind these services. They just need to know that they're secure, the data is transferred in secure channels, and also the mechanisms work at all times. Literally, that's the duty of the operators and the network or the mobile communication service providers or telecom in this situation. This paradigm has driven the hospitals to adopt the smart infrastructure, and this digital transformation is ongoing as we speak. Not every hospital is a smart hospital, it's far from that, but we are witnessing like new techniques being developed, like telesurgery, for example, robots operating on patients which are remotely controlled by humans, of course. So this can save lots of lives. Let's take an example of a surgeon who needs to travel from Japan to United States. Avoid problems in this terms of travel and impedance in such manner. The surgeon can perform the surgery from a far distance and with minimal latency. So this is called something ultra low latency reliable network slice. And this network slice provides very, very low latency. It's designed in such a way to communicate via terrestrial network in routes that offer minimal hops and the best communication portions of the slice. That comes at a cost, of course. So we are not going to discuss these details about the infrastructure layer. We are focusing on a specific problem here, and it's related to security of the data. A little bit about 5G architecture. So what is 5G? What does it have? 5G is software-defined networking model. This is because before that, 4G was considered to be also quite modular, but still we were focusing on purchasing additional hardware in case we need to scale the network. Nowadays, with 5G, we don't need to do that, and we are pretty much fine if we just run additional virtual network functions in the data center. And that's making a big difference in terms of scaling and also automation and control management of the core networks particularly. So if we go on the left image, we can see a typical deployment, very straightforward and very common type of deployment the telecom operators are practicing worldwide. So we have a data center where the telcos are running core networks. So this is actually the core network virtual functions and the physical function of course from the 4G. So these functions are running in the backend. So that central office of the telecom operators is offering some sort of connection towards baseband units. So these baseband units, they control each separately or commonly remote radio heads, which are base stations to which mobile phones and Internet of Things devices are attaching to gain access to the core network. This is done in such a way that the functions of 5G particularly are provisioned inside the core network in a rather software-defined model. This is achieved in a manner that all the functions are literally virtualized, and that's why 5G focuses strongly on virtualization. In order to scale such a deployment, like let's say in this figure up, where we have literally the common scenario we have at the moment, 4G working together, interworking with 5G to allow access of users to the common core networks in the backend somewhere in another country, or roaming, or all this everything we already have. This is a very scaled scenario, and the problem we have in our case is we are focusing on the backhaul network, which is literally the communication between the front end, the radio access, and the core networks wherever they might be situated. So this backhaul network is usually a transport network. It can be fiber, it can be inter-data center communication networks like points of presence. It can be depends on the model how the telecom operators are arranging their communication between countries and regions. In general, this is done by a couple of layers. The security, I mean, it's done in a couple of layers of the security is added in multiple different layers. So, for example, from beginning we start with the data encryption, then we have SIM authentication, then we have tunneling between the user equipment or the mobile phones and the core networks, etc. So the problem is that each of these may be insufficient in certain situations where, for example, core networks are deployed in shared clouds or public clouds. This is what the biggest operators are not going to practice, but there will be lower tier operators that can't afford to run their own data centers, and they will most likely provision their infrastructure in public clouds. And that's where the problems will start, where adversaries and attackers, they will like to steal information from, let's say, patients in our case, and they will target specifically these users or the patients itself, or even the healthcare providers, in order to extract information and use this in some way to sell it, or they can be used for different types of purposes, or attack, the distributed denial of service attacks, etc. In order to alleviate this, we propose a model where we secure the backhaul of the network. So this is on a telecom provider level rather than the user, and it should be done out of the box, and it should work out of the box. So the users and even the operators do not have to worry whether the network is secure or not. Further, we're going to introduce network slicing. So network slicing is literally dissecting a network in different logical functions, where each logical functions offers separate functionality. Like, for example, each network slice will have different parameters, different quality of service, performance, etc. So the thing is that network slices can be adjusted according to the user's demands, or according to the subscription of the user. So if the user has a fixed subscription and can't change the way network slices, or the user has like only access to 2 network slices or even 3, they can be adjusted according to the scenario he has. Let's say the user can have his mobile phone. The mobile phone connects to a communication service one, which is, I don't know, just for phones. But then the user can have television at home, or it can be like a router, like gateway or something that connects the home network at the 5G. So they can also communicate together with slice A, where you can have the same subscription, literally the same SIM card, and access maybe some different services like television related services or lower latency services for gaming, etc. So that's just a rough example how network slicing works. It's more or less similar to VLAN, except VLAN is actually used to some extent to enable network slicing on a lower level, but we're getting to that as well. Security threats to healthcare can be from different aspects. Couple of examples are mentioned in the research are electronic health records. Then we have cyber attacks also to specific individuals, targeting users, etc. Or in general, it can be the entire network for different purpose, either denial of service or information extraction. And these attacks are common, and they are becoming more common, and they will become even more common as healthcare is transitioning toward a more digitalized model and using the actual smart infrastructure paradigm. So 5G can help in certain situations because it inherits lots of best practices from 4G LTE, like strong authentication using SIM cards, etc. But this may be insufficient, as we mentioned before. What can happen in the backhaul network. So furthermore, the smart infrastructure requires a lot of automation because there will be lots of new devices, Internet of Things, and also additional users. Everything will be much more connected. There will be higher degree of connectivity rather than in 4G, and for that purpose, it requires a completely automated or even autonomous systems that can manage also security as well as quality of service and the users and everything else. So here there will be much higher incidence of overlooking certain aspects of security, and it will be much easier to provision encrypted transport network. So we can eliminate lots of these invisible security threats that we can't perceive at the moment of deploying our 5G infrastructure. The research problem, let's begin with this in our paper. So we have deployed 4G and the 5G softwareized model of a network at the Oslo Metropolitan University. We are running everything, and the core networks, they're running in an OpenStack cloud, as well as we have Edge, where we provision centralized units and distributed units, where we connect software-defined radios in order to provide access to the wireless devices that we are connecting to our network. So the problem in this research is focusing mostly on the communication between the edge and the cloud, and this is the centralized unit or multiple centralized units to the particular core network. So there are adjacent core networks. Let's say we have 2 or 3 different centralized units or a single one. They both communicate with the 4G and the 5G core networks, but the 5G radio, it just communicates to the 5G core network, and the 4G communicates only with the 4G core network. So in order to secure this communication between the edge and the cloud, we provide VPN Advanced VPN Plus connectivity. So I will talk a little bit about what is VPN Plus as well. We have a firewall, we have additional security practices here, also SIM authentication and all of that, but still we demonstrate that it can be insufficient when it comes to vulnerabilities on virtualization layer and attackers using the practices in cloud computing in order to attack the mobile networks. The solution to our problem is to integrate the VPN at the layer of the cloud where it communicates with the neutron of OpenStack. So in that case, the enhanced VPN is provisioned as a virtual function using single root input-output virtualization, and this translates and maps virtual and physical functions for Docker using a plugin known as Courier. So every container, because we're using container virtualization to provision our core networks and also the radio front ends, the centralized and distributed units, it's imperative that all the communication is encrypted that runs between the physical functions of the network interface card down to the cloud, and also goes through to the exact location of the edge in completely encrypted manner. So the thing is that we managed to secure the communication at the transport layer using enhanced VPN. So the testing and the methodology we utilized in our situation was to capture certain packets from LoRa devices. We instantiate a couple of small IoT devices, and we capture PDCP headers and try to decapsulate this. So this is a simulation of an attack. So if the attacker is capable of reading packets from other containers, and he's able to have his container in the same environment where the mobile network cores are in the same cloud, let's say, then this is representing an attack. In fact, it's a factual reality that an attack is occurring, and the attacker can spy on the communication. So it doesn't have to be a man in the middle, it doesn't have to be any sort of proactive attack vector, but it's just a fact that the user can read traffic from others, which shouldn't be the case. And then we encrypt the communication using enhanced VPN, and then we can check whether actually the communication is available again, whether the attacker can read the packets or not. So to do this, we get more or less 1,000 packets, not more or less, but exactly 1,000 packets. So we capture each, so we can see the percentage of the probability, how much of the factual packet capture is an impending attack, or it's just a normal communication inside the cloud. So we use logarithmic regression in order to derive from this whether the packets are actually being opened, decrypted by the attacker. And then we can also check the probability on the other side, whether the attacker doesn't manage to perform the decryption. So in our case, we have literally 100% capability of the attacker almost to read the packets in case when there is no enhanced VPN plus encryption. In this case, I certainly left over this little piece here, so we can see that as the attack is impending, the attacker becomes able to read the available packets coming to him. Whereas when we utilize enhanced VPN, then immediately every communication, starting with the fact that the attacker is attempting an attack, it results into inability to read the communication. So what does this tell us? There's a couple of maybe questions and frequently asked questions and answers in some of the discussions I had with my colleagues, so maybe I can pass some of these here. Is why, for example, the probability is between -1 to 0.1. First thing is that's not just a pure probability, but it's it's a logistic regression analysis. That's the actual 0 represents the line that if the data, let's say, stays on 0, we don't have an attack impending. So the fact that the actual data is moving away from 0, there is an attack ongoing, whether it's going towards 1, a successful attack, or -1, not successful attack. That's why we have this kind of inference between -1 to 1. And then can we use this methodology to other scenarios? Depends, we can, but we've shown also that by encrypting the entire communication at transport layer using Enhanced VPN, we introduce a lot of overhead from different aspects, whether it's hardware related, CPU resources, RAM utilization, and even the network suffers substantially. But we also have another research in which we managed to resolve this and to retrieve a lot of a lot from that lost communication potential and return the network back to normal operational levels. That links to the next question, whether the communication deteriorates in the VPN tunnel. That's always going to be the case, but the encryption is very it can be a highly task intensive operation, and it should be offloaded to third-party hardware like FPGAs or FPGA fabrics, like smaller edge or data center fabrics equipped with FPGAs, in order to offload this operation, so we can have encryption using VPN tunnels out of the box, and anytime we're using data that's critical, like in our case, healthcare. Another optimization we use is vector packet processing, and this is usually when we have terabits per second networking to recover some of that lost performance, but that's not the focus of this research. So that's the presentation for today. Thank you for your attention. If there are any questions, please feel free to reach to my email address. Maybe there are some things I haven't covered in this presentation, as we have 20 minutes limited, but there is much more to talk about in this topic, of course. Thank you.